I'm Ron Gallagher at Maximum Velocity Physical Therapy, and you're listening to HYPERSPEED Radio. You don't have to live in pain, whether you're running, swimming, playing a team sport, or just everyday fitness. We bridge a gap between medicine and strength and conditioning to help you break through at MVPT. Getting better at those intros, Trav.
Yep.
Welcome to HYPERSPEED Radio. My name is Ron Gallagher. I'm at Maximum Velocity Physical Therapy in Las Vegas. I have a super exciting show today. You would never believe it, but I'm passionate about women's health, which is kind of a funny thing for a male physical therapist to say. But I have two guests today that are absolutely amazing women and champions for women's fitness and women's rights and women's this and that. And I'm going to do my best to stay in the background today because they're amazing. But however, when I was in undergrad, we had a women's health physical therapist on staff. And that was the first time in medicine that had happened. She was the only one west of the Mississippi. I don't even know if I ever told this story to Susan, but she had a women's health class that I audited. The only thing I didn't do was the pelvic floor exam. I was absent that day. And I learned an incredible amount of information that I still use today, and actually used some of that information on Laura's preparation for being pregnant and her pregnancy. And I've used that with hundreds and hundreds of ladies, helped them with returning to running post-pregnancy, urine loss, the whole bit. So I'm excited today. One of our guests today is one of my prized students, Trav. She was a high flyer from the get-go. Nobody worked like she worked. Emily probably is not happy to hear that, but Susan left Las Vegas. She graduated high school here in Las Vegas, left Las Vegas to go to Ohio. Her family's from Ohio. She graduated from Walsh University with a doctorate in physical therapy and was exposed to women's health there. She had worked as a traditional orthopedic PT and then has opened a women's health specialist. I hope I got that right. Fell in love with the population of women who are definitely underserved and undereducated. This particular paragraph, I don't want to mess up, so I'm just going to read it. Through pregnancy, postpartum, and beyond, there is a lack of resources and services available to women to educate and empower them during these changing times physically, mentally, and emotionally. Susan works to bridge the gap between an interdisciplinary and holistic approach to guide women through their journeys through pregnancy and postpartum wellness care, physical therapy to treat common but not normal issues such as leaking, prolapse, diastasis associated with pregnancy, postpartum, pelvic pain, pain with intercourse, and others that limit a woman's ability to do things they love. I love that paragraph because that's exactly what we're about today. So without further ado, Susan Facemire in Ohio. Hey.
Hi, everybody. Hey, I'm happy to be here.
Oh my God. I'm so proud of you. I don't even have words. I'm so proud. And I've tried to bring her to Vegas. I told her I'd open her some rooms and give her everything she needs. And she loves Ohio. So whatever. Your mom's here. You could see your mom more often.
I could. She's traveling out here quite a bit, but it's time for me to probably start going out there a little more.
Well, we would love to have you if you're ever ready. So tell me, in your words, what would you say is women's health physical therapy?
So it's broad and narrow all in the same time is what I like to say, because we think of, and I've had this come from questions that people ask me is like, as a pelvic floor specialist, what do you do? And it's, yes, I look at the pelvic floor, but really what's important with that is taking that functional holistic approach that we learn movement-wise, movement-based analysis in PT school, and applying what's going on in the pelvic floor to the entire body.
What's the pelvic floor?
What's the pelvic floor?
Yeah, what is the pelvic floor? Oh, she's got...
I bring this wherever I go.
Yes.
I bring my pelvis wherever I go.
I love it.
So the pelvic floor it's basically a group of muscles that extends from the back of the pubic bone and then all the way, kind of twist this around to tailbone, sacrum.
Yeah.
Up both sides of, the hip. There's actually a hip external rotator, that one of the deep ones, obturator internus, that attaches internally, and I can isolate it out within pelvic floor, my pelvic floor exam.
Interesting.
So it's I don't have the superficial part, so there is a superficial layer right here, and that's where I think
a superficial layer of muscle.
Yeah. So it's, hang on one second, I can grab it for us.
Love it. I'm in love with the visual cues. I love it.
Yeah, it's magnetic, so it always falls off. So you can see that superficial layer.
Jokes.
We have kind of
so many jokes.
So many jokes. I was like, I lose it all the time because it's in my car.
You lose what? Just kidding.
My organs. So when we look at this, you can kind of see how there's almost like sphincteric control muscles right through here.
Yeah.
And I feel like so many people, without having background knowledge or education or any, just no awareness is brought to the area, that's pretty much where our thought process is, where it stops. That's where the pelvic floor is.
Right.
That's all that works. So let's just do Kegels. Well, it's a soapbox that I get on all the time.
So Kegels are not the end all be all.
Absolutely not. It is just, after that first visit, usually with most people, I don't use that word ever again. Oh. But it's a good kind of return to frame of reference.
So let's talk about that. So when you say Kegels, you're referring to the muscles that are in that superficial layer, not necessarily the deep layer.
It's, when I refer to Kegels, I'm just referring to any kind of awareness that they might have to perform a contraction. So that's where that's our starting point.
Right.
We say, okay, let's do your version of a Kegel, because they maybe can associate that with something.
Right. What percentage of women are performing the Kegels incorrectly when they reach you?
More than you would think. And it's, they could tell me how to do it and everything, and I'm either getting no contraction, a bearing down, right, or they're just like, I think I'm doing it, but I'm not doing anything.
Right. We're gonna come back to that.
Okay. Yeah. So it's just a matter of, the pelvic floor is more than just those superficial sphincteric control muscles. It is a support system. So there's a kind of 5 main functions of the pelvic floor. We have support, sphincteric control, which are the 2 big ones that we look at.
When you say support, you're supporting the organs, right?
The pelvic organs that sit on there, but not only the pelvic organs, because what's right here,
right,
your abdominal organs. So this whole blank area that we're looking at right here, that's your abdominal wall.
It's the bottom of a bowl.
It's the bottom of the bowl. So yeah, it's not just your bladder, uterus, rectum.
I think people don't see that often.
Exactly.
That's an important concept. So sorry to interrupt. Like I said,
you're good.
I did want to be in the background mostly. So go back to number 2. What was number 2?
Number 2. Sphincteric control. So that's the big one when people think of pelvic floor, is do your Kegels.
Right.
Stop the urine.
Right. Close the hole.
Then we have, close the hole. We have stability, because front to back, right to left, it has that control. It helps to stabilize, the big one, especially in pregnancy, SI joint back through here.
Right.
But it's, all of this has a very big ligamentous support. But when those are a little bit more lax during pregnancy and postpartum periods,
right,
the pelvic floor has to help balance that out. And we see that a lot. And then so that was 3. The other 2 are pump. So
the muscles of the spine and the pelvic floor are neurologically hardwired to stabilize the back of your back.
Correct.
Yeah. Okay. Got that.
Yep.
So fourth, right?
Fourth is sump pump. So they help, are one of our big drainage points for the lymphatic drainage is right in that groin area.
Yeah.
So it does help to improve that highway system to help with that drainage through that spot.
Right. And the body drains. This is an important concept. The body drains fluid with muscle contraction.
Yes, it does not have its own
this
way
is
to do that.
The pelvic contraction pump to remove that swelling or lymphedema in this case.
Correct. Yep.
Oh my gosh.
And then
we're already off to a rousing start.
And then the other big one is it's sexual function. There's a ton of nerve innervation through this area. And so it plays a big role when there's a disconnect through the pelvic floor. There's very much a potential for that disconnect with the nervous system, which can impact libido, it can impact orgasms, it can impact pain with intercourse. So there's a lot to say with pelvic floor weakness and how can it affect sexual life. So those are just kind of the big overarching ideas and where we can kind of funnel in. But what I see is, it doesn't ever just funnel into one of those jobs. There's so much carryover. And with that being said, you can't just look at what the pelvic floor is doing, because what we alluded to before, well, what's going on with the back? What's going on with the abdominal wall? Right. And then the other huge one is what's going on with the diaphragm in your breath, because those are the two ends of the canister. Right. And if they're not communicating and don't have the optimal alignment, functional pressure management, ground reaction forces from the ground up, then we have a miscommunication. I kind of equate it and learned through one of my courses. It's like a gear system. So if any one of those gears down the channel aren't working, then it's going to bind up and it can't move through that system. So it's so important to look at all of those things.
Oh my God. I'm such a proud coach right now. So I just want to back up on two things. One, people don't realize that if they are having sexual dysfunction, a person like you can help them. So a women's health specialist in your area, if not Ohio, Susan can help with that. And number two, she's trained to look at that gear system in a way that helps improve performance and help get you through whatever limitations that you're having. Maybe you should be a regular guest, and maybe we could do some other stuff, because there's so much in there to unpack. But what I prepared today is basically a introduction between Susan and have Laura on. Laura Fernandez is a strength coach, CrossFitter, former college athlete, who's been on the show before. She used to have icebox strength within the clinic, and she had, in my opinion, the most healthy pregnancy known to man. like the top echelon of what I think can happen in a person's pregnancy, pre, during, postnatally. She was the healthiest I've ever seen a mom, the least amount of pain I've ever seen in a mom, and as far as I'm concerned, the perfect example of what can happen during a pregnancy. And so we're going to welcome Laura Fernandez to the show. Hey!
Hi. Yay. Hi. Thanks for having me back.
She moved away, which we're super sad about, but she's visiting her sister, who I love. Hey.
Yes.
And she's actually in Lubbock, Texas, but she lives in Utah.
Yep.
So today we're in Ohio, Texas, in Vegas. And let's welcome Laura to the show. Hey, Laura.
Hello. Hi.
So what we did is Laura came to me and she was like, I'm pregnant. What do I do?
No, I think I came to you and I was like asking like discreetly, like, so if somebody's pregnant.
Right. She started out with asking for a friend.
Yeah.
What do we do to make sure that we have the healthiest pregnancy? And I'm probably nowhere near as capable as Susan, but this is what I've been telling people for a long time. Hopefully Susan's okay with it. Is we've got to prepare for this pregnancy as if it's an athletic event. Mm-hmm. And essentially, if every single bit of your connective tissue is about to get longer and you're already a flexible person, I feel like those pregnancies are the most painful. And your toes get as much oxytocin as your pelvis gets, as much as your ears get, as much as your fingers get. And that's the hormone that's floating through our bodies that actually make all of our connective tissue longer. And that's why knees hurt and feet hurt and back hurts and blah, 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 because the length and tension ratios get removed as soon as that hormone is released. Anything to add to that, expert Susan?
You're spot on with that. Like that's what I tell all of my clients when we're seeing, when they're coming to me during their pregnancies, this is a training event. Whether 100%. I kind of use the marathon example is because it's an endurance event. And so whether or not you have been active during or previous to your pregnancy, or you really weren't active, I still think, and there is research-driven results to show that there are so many benefits to not only continuing your exercise program, but starting one during that time. And having the guidance is obviously important, and there's things to consider, but it's so important. And I think that you have so much better outcomes. The babies tend to have a little bit less of a birth weight, decreased risk for gestational diabetes. There's just so many benefits to it that and going about it in a very skillful way, knowing how to modify, when to modify, but also I feel like in so many aspects is knowing that your body is capable of this. I feel like with pregnancy, and you could say this to an extent a little bit with the geriatric population too, but is we almost like put you in a box. Oh God, you're pregnant. You can't let me do that. You can't do that. And I'm like, I'm pregnant. I'm not disabled.
Right.
And your body
Huge. That's so big.
Yeah. And you can adapt to that, and you can strengthen, and you can prepare. And it's actually the best thing you can do for your body, is to exercise and keep that going, because you're going to have a better postpartum period and recovery too.
Right.
So, yeah,
well, Laura's the perfect example of that, for sure. So one thing I say almost every day is healthy moms make healthy babies. And I feel like Western medicine handles the baby's health legally more than the mom's health. And I think a lot of this information is basically born in that context. And so I would say Laura had a very mom-centric way to handle this pregnancy. And let me tell you, man, it was spot on. So anything before we start this video?
No.
All right. Trav, video 1, the pre-pregnancy, and watch awesomeness of Laura. That's actually what I called the video. So go ahead and stop. So first things first, Laura came to me and she was like, so basically asking for a friend, if someone was to be pregnant, what would we change about exercise? So I said, we need to overemphasize pelvic control, hip and back stability, and then shoulder and neck stability. And if we can start from a strength base from those muscle groups, and then train regularly, the longer you can keep your back and hip and pelvic stability, the longer you're going to be able to train. And I feel like the healthier you're going to be. So that was our goal from the very beginning, was just to be a continuation of what she was already doing. So I'll say that, she was already very fit and very strong when she was pregnant. So it wasn't like she turned this on as she was being pregnant. So that's an important distinction, because I think some women are, surprised by being pregnant, and they're not necessarily conscious with the way that they're moving and preparing. Although I have been a part of many women who do say, well, I was kind of thinking about getting pregnant. Is there something I should be doing? Yes, you should be building a strength base for this endurance event. So, so really, the baby started to show. So that's pretty much why we started with those videos there, right? So at 3 months pregnant, she's still underneath that bar. Let's continue. How much was this, Laura? Do you remember?
No, I was doing my regular, whatever I was doing before. So I didn't really.
It's heavy, everyone.
Yeah, I didn't really. I didn't modify much at this point. I mean, I didn't modify weight at this point.
So 5 months.
They usually say up to that, within that first trimester. I mean, because let's think about it. I mean, how many of women are walking around 12 weeks pregnant and they may not even know? Like there's so much of that. So yes, there are things to consider, but at the same point, well, many women don't even know they're pregnant at that point. So
stop, Trav. So that was 5 minutes, or 5 months, I should say, 5 months. How many weeks is the trimester?
So 0 to, depending on which you talk to, 12 to 13 weeks is trimester 1.
So I think the women who are listening will definitely know exactly what that means, but I don't know the first thing about how much time that takes. I need to refer to my textbook. So you're saying for the first 12 weeks, some moms don't even know that they're pregnant.
Right.
And I didn't feel, every pregnancy is different, but I didn't feel pregnant aside from like being a little bit tired or like just me knowing my body, knowing something was like different. I didn't feel pregnant. I mean, I was still doing everything that I was doing before, running, lifting, all my workouts. Like I did everything the same.
Basically, you were taking the approach that until it changed you weren't going to change anything.
Yeah. Until my body, like I felt like something didn't feel right or felt uncomfortable and it was something that I couldn't go to you and ask you, like, is that normal or is this how it's supposed to feel? Or, just until I couldn't do it, then I was going to continue doing it.
Right. And one thing that I really want to talk about is the hate mail that started to come. So I wanted to make sure that we get that part of this thing started because Laura's a leader in her community, and she was very, very open about what she was doing. And eventually the background chirps that were coming began to be very, very, very negative and very, very toxic. So here we are at 5 months. Did that start yet?
No, I would say when I started showing probably like around 6 to 8 months, it got really bad. And then,
when you say it got really bad, you're talking about the crows in the back.
Right. Yeah. And I did have some like love too. People were definitely nice, but it was like people that I didn't even know were messaging me and telling me that I was selfish and I shouldn't be lifting. I should be thinking about my baby. And why would I put so much pressure on my stomach?
We're revving that engine. I can see it, Susan. You can go anytime.
I was made like I put like a lot on social media because I mean, a lot of people go to social media to, find things or information or whatever. And so I posted a lot on social media. And like, for the first part, I was like, oh man, I'm not getting any hate. Like, this is great. Like I could track my progress. Like I have it all saved, like on my highlights and everything. And then when I started like showing and like getting more of a bump, people were just sliding in, and it was like at first, because it goes to like a hidden, like a request or something like that.
Yeah.
And so at first I was like, what is this? Like, I've never seen this before. And then I was like reading them and I'm like, oh my gosh, like,
yeah.
And then it almost makes you not want to post. And I'm like, this is my journey and my story of my body and my baby and what I'm capable of.
And to your credit, you did not back off. From a social media point of view, I did not see a change despite the effect that it had on you. And I know Susan's ready to go. So go.
Well, it's like, it just kind of builds off of what we just talked about. It's like, I would love to know what these people's backgrounds are to have the credibility.
Oh, they're former moms. That's about it.
Yeah.
And it's like, it just
former moms like
drives. I mean, and here's the thing, even especially if you say that with their former moms, it's like, we don't get enough education as moms during this time on what is appropriate. The OBs are not fitness professionals. It's not really their job to educate in this aspect. But with that being said, that's why I do what I do. But where is that person? Who is that person? And why aren't we more easily accessible? Why isn't this part of, you take the childbirth education classes, you take the breastfeeding classes, you do the hospital tour. Why is PT or progression and the benefits of this not a part of our standard care? Because if that were the case, if we had more education and people weren't so ignorant to what the benefits of exercise are, then we wouldn't see as much of this, for one.
Mm-hmm.
And two, you were doing all of the right things. So yes, there are situations where you're not supposed to be lifting heavier and things like that. But if you don't have placenta previa, is a big one.
Which is what?
So that is when the placenta is covering your cervix, basically. So it's supposed to be, if the uterus is here, the placenta is supposed to be kind of in front or behind, but not below the baby. And so if baby is here in the amniotic sac and your placenta is underneath, and then the cervix where the baby is supposed to come out of, through the vaginal canal, if that placenta is in the way of that, then that can cause medical emergencies. It can lead to complications.
I mean, it seems like it would affect the blood supply to the baby.
Yeah, and it also can affect hemorrhaging to the mom with delivery.
Gotcha.
So
if a person has that, at what point in the pregnancy do they learn that?
It's different with everybody.
Gotcha.
So a lot of times with previa, many women will have some spotting or bleeding. So that is not necessarily that something horrendous or a medical emergency is happening, but it's obviously something that you want to go to your OB or call your OB and talk to them about what the next step is. And they can usually, what bleeding can mean many things. It can be a subchorionic hemorrhage, which may be indicating some pelvic rest. They may have you back off on exercise for a period of time to see if it resolves. They can check for previa with an ultrasound. And if that's the case, likely you will be restricted in what you can do exercise-wise. Right. And those are the two biggest ones. And then we have, later in the pregnancy, preeclampsia. There's risk factors, but even with some of those, especially if you're on bed rest, there's more and more research coming out within the public health world of there are still things that you can and should be doing, especially with some TA activation, with some breath work, so you're not losing everything. Right. But those are the exceptions, not the rules.
Right.
You know what I mean? So, and that's where we get it. It's like for somebody that is having a perfectly healthy pregnancy, they have been cleared by their doctor to exercise. They were exercising before at this level. And like we've already emphasized that with Laura, that's the most important part is, you're not going to start your heavy lifting journey when you are already pregnant. Right. Should you still do some lifting? Yes, but we're going to modify those weights to a much different aspect of it.
Right.
But knowing what your body can do, having the right guidance with a movement expert, i.e. Ron, you know what to look for, to listen to your body, and to have that. There's absolutely no reason you can't do the things you were doing as long as they feel correct.
Right.
Yeah.
And you have that guidance, that's what
Right.
we're looking at. Your form is still good. You're still able to get into those range of motions, or
Right.
if you're not able to, you're decreasing your load or decreasing your range of motion, but you still are able to do 90 to 95 to 100% of what you were doing before.
Right. And Laura ends up being a perfect example of that, because you'll be able to see as the pregnancy goes on, she was very smart about how she modified. And, being a coach and a lifelong athlete, and, she spent a lot of time training with her dad, who's, seems like he's got his stuff together. And, so she was more educated than most, but she never stopped, and she stayed committed. So one thing that I heard is the word bed rest. And I think that it's important for the listener to understand that this can be just like any other orthopedic issue, in that modifying the exercises to make them a load that you can tolerate, a load that you're prepared for, is better than full rest. So a lot of times I feel like this bed rest recommendation is legal advice and not medical advice. So nobody wants to be responsible for an unhealthy baby. So they'll just tell you to do the least common thing, the lowest common denominator, so that everybody's protected. But really what that ends up doing is exposing the mom to trouble. And if we have unhealthy moms, we increase the risk of having an unhealthy baby. So we need to be better at educating moms so that they know that maybe that full bed rest is not the best way to handle it. Susan, thoughts? Go.
Yeah, and I mean, in conjunction with that, it's like, so it's obviously we don't go necessarily totally against what OB is, but that's an opportunity. That's a learning opportunity for everybody.
Right.
In that aspect is
right, because they need to be educated as much as the moms do.
Exactly. And that's where it's like, we have to look at and ask the hard questions. It's not necessarily even the patient relaying it. I'm getting on the phone. If I have somebody that's on bed rest, I want to talk to that OB.
Can we do this and not that? Yeah.
and just really see, what are the risks? What are we looking for? What are we trying to protect so that we aren't making anything worse?
Questions. Very good questions.
And also take that opportunity to educate. So this is why we want to look at some of this stuff and kind of how that helps out, because in addition to that, with bed rest and just, I guess, the immobility in general is, again, going back to where the benefits of exercise is, when we're more active and we have a better stability and support system through that pelvis, it allows baby to more optimally engage, which is going to ultimately, in most cases, help with delivery. So if, especially with like diastasis, 100% of women will have some bit of separation by the end of their pregnancy.
Right.
They're physiologically, there's nowhere else to go. You can't really go out the sides. You can't really go out the back. You have to expand somewhere.
Right.
But the problem that I see is part of the mindset with that is, I'm going to have a diastasis. I'm going to have a split. So I'm just going to flop it out, let it just kind of hang on my tissues.
Right.
If we don't have that good activation and proper alignment, it can let baby sit in not a great position.
Right.
And that can impact delivery,
oh my gosh,
make you push longer, potentially get the baby stuck.
I didn't know that.
It's those things that are also impacted. That's like, well, you say you want a healthy baby, you say you want to have an easier delivery. These are the steps that are going to, again, pregnancy it's hard and everybody's is different, and you cannot predict the outcomes 100%. So everything that I'm saying today, there's always going to be an outlier. There's always going to be an exception.
Right.
But within reason, the things that we're talking about today and all the exercise, why wouldn't we set ourselves up for the potential of the best outcome, which I think is exactly what you were doing, Laura.
Right. And the anatomy of that diastasis recti is actually transverse rectus abdominis splitting,
Abdominis.
right? So
that linea alba is separating.
So if we walk into the pregnancy with the strongest rectus abdominis, is that muscle more likely to split or less likely to split?
So I'll be honest, I wouldn't say strongest, because it has a lot more to do with the tensile integrity of the fascia than necessarily the strength of that rectus abdominis muscle. I would actually look more at, what is the overall core stability through pressure transmission, force transmission through diaphragm, transverse abdominis, pelvic floor, and then how we carry ourselves. Because a lot of times, if we have that, as baby grows, we get that bell rung up.
Right.
That rib flare that has to happen to an extent, but doesn't. When we're at 6 months, we can still probably get it down a little bit. We don't have to sit out here on our rib cage.
Right.
That tension, plus you think of the pelvic bowl in a more anterior pelvic tilt.
Right.
So on both ends of that, now you have a stretch.
Oh.
It creates.
Good. That's so good. Laura, do you understand that? Like, is that easy to understand?
Yeah, I think it's cool to hear her say that, because I had you and I had my OB.
Right. So the reason why I ask is because I gave you the right stuff, but I was lucky, to be honest. Lucky.
Yeah. Well,
I'm doing what, Dr. Crum eons ago told me what to do, but that level of understanding I did not have. But it makes so much sense. So remember how we worked on the transverse abdominis and multifidus, and how we actually set the core, right? Because it works like a corset. And those muscles are neurologically hardwired to the bowl. And if everything's working together to work as a corset, top and bottom, and then you don't get that pelvic tilt because of the way that the beach ball is pulling on gravity, then you don't get that big stretch over the musculature that ends up splitting. Mm-hmm. Is that accurate? That
is. And before, because it's on my mind now, so I don't want to forget it, it ties in really well with this, is, when we're looking at that, what's just as important in that aspect of tightening up and zipping up through the core is that recovery breath, or that kind of release. Because what I see more often than not is, in athletes, the problem typically isn't a weak pelvic floor, in a sense where it's just kind of, it tends to be a little bit more up here. And so that can pose an issue when it comes time to, I'm going to push the baby out, because I'm going to say right now, the pelvic floor does not push the baby out, the uterus does. Right. The job of the pelvic floor is to get out of the way. So when we see it more in athletes than we do in maybe your lay population, but we have more tone through that pelvic floor. So it's not, I think that's an important aspect that maybe is overlooked a little bit more, is it has to be that balance. You have to have that zipping up, but you also have to have that release and that good expansion, because of the balance that you need through the pelvic floor. For, you need all of this stability as you're growing and carrying this tiny human and your body is changing. Right. But then when delivery comes, you need to be able to kind of open up that pelvis and let that baby come through. Right. So it's a tightrope sometimes. And I'm learning so much. Education.
This is so cool. Okay. We're getting a little behind. It's been amazing information, but we got to stay on task. So so let's go back to this video. I think we're at six months here.
Mm-hmm. You look awesome. This is awesome.
Yeah, we haven't even got to the good stuff yet. 265 at 5 months. Hey, cool shoes, dude. Mm-hmm. So I'm going to try not to get emotional. Sully's walking around back there somewhere. Aww. I miss that guy.
Sully.
I'm going to try not to get emotional. This is like crazy to see my belly like that. I don't know.
There he is.
There he is.
5 months at 155. So by now, she's starting to modify things, and she's also starting to get some serious pushback from people she doesn't even know. Let's stop there. So she's probably got like 15 or 20 pounds in her hand right there. So if she was,
I think it's more than that.
Oh, she's like, excuse me. Maybe it's 20,
30 pounds, but I mean,
but she would normally do more, right? You would have normally done more, right?
Yeah, I probably would have done like now I would probably do 35s.
So, so if I remember correctly, this is where the modifications sort of started. And on Saturdays, the Icebox group would do some workouts at the park. And this if you can correct me if I'm wrong, but I seem like this is right around the time where you came in and you were really, really, really upset. I mean, I could tell that you had been crying and shared a really, really ugly message.
Yeah.
And to her credit, she's deleted these toxic messages because who wants to keep that toxicity around? But let's talk about what the message said, and I want Susan to kind of I want her to explain where that comes from and what we need to do to change that. So tell Susan what this person said.
I actually think I posted that video of me using dumbbells. So I stopped using a barbell because the bar path and hitting my belly was just, so I just used dumbbells. And
so you don't want to hit your belly anymore?
No.
It's probably
well, and that makes sense because it changes your center of gravity. So that is the absolutely appropriate progression right there.
Unless I was going to stay overhead, like in the front rack, then I would use a barbell, but anything like a clean, or I just would use a dumbbell, and I was fine with it. I mean, I just cared more about working out and just moving. So it was fine. I was fine with it. But I think it was that video I had posted on Instagram, and I want to say I had gotten like 3 messages. One of them was, I'm hurting my baby and I'm going to cause my baby to have a birth defect. Yeah. And I mean, I was like, now I look back and I'm like, oh
dumbbell
my God.
cleans at the park.
Like, why?
A birth defect. Okay.
Yeah. Like, I look back and I'm like, oh my gosh, why did that affect me so bad? But like, I was pregnant, I'm a new mom, you know what I mean? And like,
you're emotional, your hormones are flooding. You don't know what this is.
I mean, I had a really good OB, and my OB was like, just continue doing what you're doing. Like, you know, your body, you're an athlete, like, you know, what feels good. So like, if it feels good to you, do it. If it doesn't, don't. Like, and my OB was really good about it. And, you know, I had Ron, but aside from that, it was like, I didn't really have anywhere, you know, like anybody telling me like, you're doing good. And aside from social media, and in social media, I'm getting that. And then I'm going to have a really bad labor because my muscles are so contracted that I'm not going to be able to get my baby out. And then I think the other one was just like, I was like selfish, and I can't like believe that you're going to be a mom because you're treating your baby this way. And like, I was just like, so it makes me like, it's so emotional, even like hearing that or saying it.
That blows my mind that is.
Where does that come from, Susan?
Ignorance.
Yeah.
I mean, so
where would these moms learn that?
I don't know. And so that's where it's hard because, you know, I'm so inundated in this world and the education, the research, that I'm just like, to me, that sounds like somebody is under a rock. And the only thing that comes to the top of my head is their personal experience. Like, potentially, maybe they're trying to come from a place of they knew somebody that was active and that happened, and they're making a causation jump to that.
Right. That's a mess, right? That correlation causation mess.
Yeah. And so like, other than, and we already talked about this part, is the pelvic floor being tight and potentially causing some difficulties in labor. There is a little bit of validity to that, but that is not the way it should ever be presented for one. And again, if you're doing the whole aspect of it and focusing on both the lengthening and the activation, working on that aspect of it, then that's going to offset that a lot. And it is, again, it's not you're active, you're strong, you do all these things, you automatically have a tight pelvic floor, you won't be able to push the baby out again. So there's so much more that goes into that. The other one, the birth defect, I'm like, I mean, I am not an OB. I don't know as much about the obstetric side and birth defect side of that world, but I'm like, those are genetic, right?
Yeah. So there's definitely no correlation, no causation, no reason to believe that the exercise a person is doing can influence the development of the baby.
Not that I've ever heard.
Let's just get that out of here, because the level.
I've never read anything.
I got to see Laura's face when she came in the clinic, and she shared all those things. I literally sat her down on the table and just went from the beginning. Listen, healthy moms make healthy babies. This has more to do with that person's ignorance and that person's selfishness, and has nothing to do with what you're doing. You need to keep going.
Right. It's actually, you're benefiting your baby. Lower chances of attention
for real
issues with babies, healthier birth weights, like better sleepers, better eaters. Like that is in the research.
My baby is all of that.
Well, so she doesn't have a choice with the parents that she has.
I know.
Yeah. Apples don't fall far from trees, if you know what I'm saying.
So,
all right.
I don't know. I truly couldn't tell you where that comes from.
Blows my mind.
Yeah, it's just.
Yeah.
I don't know.
All right, let's keep on going. Keep on going. So here we are. This is, what was it, 7 months?
I think 6.
6 months. Yeah. So here we are, still at 6. Heavy things above her head. Shoulders, necks. I love this for continuing to stabilize. Upright posture, right? So now that Susan shed some light on some biomechanics of having the baby there, being able to protect her neck and shoulders from slumping down. So this is Laura's modification of a burpee.
Mm-hmm. But I love it. It's like, it's like you're wearing just right thing. Like, so you see that you're still keeping good alignment. We're not dipping into that, where that pelvis is going. I don't see any coning or anything like that. So, those are things that we look at in those like plank type positions, is if you're having any coning. And at that point too, I'll say, just because you have coning doesn't mean you have to stop everything. That's another big, it's diastasis and all things surrounding coning, separation, all that. It's really big in the pelvic health world right now with athletes. And there's it's a lot of fear-based, fear mongering.
Yeah.
Oh gosh.
Yeah.
But if you're doing the right things and you have all of that in place, and you've got your breath work, you've got your alignment, you've got your pressure management, you're pretty limited in what you can't do versus what you can.
I think I had asked Ron too. I was like, am I coning? Remember, I would come in all the time, because on social media, it was like a huge thing. Like,
right.
Don't cone. You don't want to do. So I would like ask Ron, like, Susan, hold up my shirt and be like, am I coning? Is this
explain
like,
what coning is?
So coning is when you would be you put more tension through the abdominal wall, and it would be just like that. So when you typically activate through the abdominal, I'm going to hopefully kind of give a good picture. So as you would activate, it would kind of flatten and engage. A coning is as you would activate, it's going to, like, right in the middle, potentially kind of start to bulge out like that.
Gotcha.
In either part of the abdominal wall or maybe all of it. It's different for everybody. And again, you just have to look at pressure management. What's going on there?
That would condition it to actually separate.
It's probably already separated at that time. It's just a matter of how the forces are being transmitted through that separation.
Gotcha.
And not all coning is bad, but you have to look at where the rest of the pressure management and proper abdominal engagement is.
Right. So, get back to the gearing. Something's wrong with the gearing somewhere.
Yeah.
Man, I'm putting it all together. Let's continue. So here we are, still at 8 months, And eventually she modifies those burpees with boxes, which I thought was brilliant. So she modified her stance here. This is not her normal deadlift stance, but at 8 months, she's still got a decent load here.
Yeah.
Again, modified her stance. This is a little bit wider for her, more knees pushing out. She's just allowing room for that belly to move and continuing to lift heavy and continue to protect her connective tissue. 8 months at 155.
That is fantastic. What is it with strengthening and stuff, especially we can do this while we're watching it, is like, this is such important stuff because we think about optimal birthing, actual pushing positions, and how, I don't know how you delivered, Laura, but like that lithotomy position is just not ideal. Birthing in a squat position, in a all fours or tall kneeling, those are just so much better positions. But if you don't have the strength and the endurance to hold them for long labors, like you're not going to be able to do it. So this is, again,
there's my belly.
Look at that belly. Look at that belly.
And I was 8 months pregnant. I remember looking across the room, just completely in awe and completely inspired that, she's kicking ass.
This was like a week before I went into labor.
Yeah. So I sped this up a little bit. That's not how fast she moves.
No. This was like a week. I want to say it could have even been like 5 or 3 days before I went in.
That's incredible.
Labor. But I worked out the day I went into the hospital. Like I did not stop.
And you had a good, I was like, are we at the point where we can share the labor story a little bit?
Well, yeah, I think the next slide is actually her with Aria.
Oh. Look at that big old belly. I forgot what that was like.
Oh. Healthy and happy with no complications and no trouble.
I did have a C-section though. So I ended up having to have a C-section. I was in labor for 2 days. It was, but I mean, I would have kept going. I told Dennis, like my husband, Dennis, my blood pressure kept dropping, like on the last, when they decided to do the C-section. And I told Dennis, it felt like, when you just like work out really hard and you get like super lightheaded and you're just like, oh, like I just need to like rest or like lay down and go to sleep. And that's what it felt like. And then they were like, my oxygen dropped, my blood pressure dropped. And so they were like, we have to do a C-section. Like she's not looking good. But I thought it was just like working out. Like I was like, oh, I could do this all day. Like give me a minute. Like let me recover. But I was having pretty close contractions and I wasn't getting dilated. So I think I was just so comfy being pregnant. I wasn't ready. Like I went a week past my due date. But I never got dilated past a 1. And I was having contractions like super bad. Like at one point they were like 30 seconds apart. And then so it just got to the point where like, I think it was like my blood pressure just kept dropping and like my oxygen wasn't good. And so, Dennis was like, no, like, let's just get the baby out, like get him out, like get him healthy. And, I actually was like pretty sad because I was like, I didn't even get to push. Like I didn't even.
Okay. That was going to be my question, but yeah, 1 centimeter.
So do you hear any of those problems related to her exercise, or is that just pregnancy?
The only thing I would potentially say is maybe working a little bit more on lengthening and kind of having that in that the last few, like usually it's towards the end of the pregnancy. So during the 3rd trimester, not necessarily taking away the weightlifting, but adding in some of that lengthening positioning work, maybe. But again,
lengthening positioning of what?
The pelvic floor. So learning how to kind of lengthen. And then there's also a lot of different, whether it was because she wasn't engaging. So it is, and this is a question, I don't know the answer to it, and we probably will never know.
No, I get it. Speculating.
If we could get her to engage a little bit better, would that have changed how you could have potentially dilated? And so those would have been like, when I do birth prep with moms, we're still working on strengthening all through that third trimester, but we're also putting an emphasis on positioning to help optimize during the last few weeks to try to get baby to engage a little bit better, to make sure that we're able to open a little more, kind of positions to optimize that. And then once we're in labor, we kind of have to flip it around, because we want baby to engage in the inlet to start with. So we want to favor positions that create more external rotation, more posterior pelvic tilt, and with that. But then when we are trying to get baby out, we want to focus more on some more internal rotation and some more anterior pelvic tilt. So it changes
because it kind of flares the pelvic open.
It flares the pelvic open versus the top versus the bottom.
That's amazing.
So,
Absolutely
with
amazing.
some of that,
bodies are amazing. Bodies are amazing.
Are.
Good Lord, that's amazing. That's so cool.
And again, would it have made a difference? Maybe. I mean, that's how I was. I wasn't progressing at all with my daughter, and I was on Pitocin the entire time. And so, but I spent a lot of time in just that tall kneeling against the back of the bed, trying to just get her to engage. And she finally decided to come out at 41 weeks and 5 days. But yeah, so it's speculation, like you said, but that would be potentially and the only thing that I would have looked.
This size of a problem, right?
In the long run, absolutely. Absolutely.
That's awesome.
Because I'm now looking at the postpartum, I'm excited to see kind of how that process has gone.
Right.
Even more so because you had to have your entire abdominal cavity opened up, and it's a major abdominal surgery. And
which I don't think that they put a lot of stress on that.
No. And actually, so April is Csection or cesarean awareness month. So doing a lot with education on my social media channels this month about that. But it's like orthopedic wise, you have a total knee, you have a knee scope, you have anything. What do? You go to rehab.
Yeah.
We're going to cut you open 6-7 layers down and take a baby out of your uterus, pull you back up, and
just
send you
6
home
weeks
with
of bed rest,
human.
you'll be fine.
Yeah.
And then
6 weeks of bed rest, you'll be fine. So no worries.
Are we in the postpartum talk? Because that was my favorite part of all of this.
All moms do it. Okay. You can do it. You're a mom. You can do it. Absolutely, positively hate it.
I feel like if I would have posted more of my postpartum journey, I probably would have got hate too. Because I started soon. I started 4 or 5 weeks.
Well, this is how I remember it. And you can talk to me. You can tell me if I'm wrong. Around 2 weeks, Laura's like, "Can I start? Can I go? Can I do it? Can I do the thing? Can I do the thing?" And I was like, "Well, hold on a second. What were the recommendations that you were given? 6 weeks of complete and utter rest. 6 weeks of nothing." I said, "Well, honestly, I don't think we should do that."
I actually think they told me 8 weeks.
8 weeks.
8 weeks.
8 weeks of prescribed rest.
Nothing.
So around the 3 to 4 week, we started some breath work. We started some easy transverse abdominis and multifidus awareness. We started some easy exercises around the 3 or 4 week. Eventually, we expanded those exercises to include hip stability, super duper light. I mean, the woman is operating against gravity with a baby in her hand. How in the world are exercises that are a tenth of that load going to be a problem?
Yeah.
So we started very light. And then by 6 weeks, she's normal back stability, normal hip stability, absolutely no pain or any limitations at any time. Otherwise, we would have slowed down. And then here's postpartum. And stop. 7 weeks postpartum after 2 weeks of rehab. That includes all the foundation exercises to stabilize her back and her hips. Eventually getting more and more and more load. So 2 or 3 sessions a week, plus tons and tons of homework.
Yeah.
3 weeks later, she touches her first barbell. And this is probably like 55 or something. So for Laura, in the grand scheme of things, this is a ridiculously low amount of load, right? So if this is her first time touching deadlift, it's probably not the best time for that. But because of who Laura is and what she did this whole time, right? She's able to start doing some things that are very, very light for her. So, if that's a problem, Susan, I want you to tell me and be frank.
No, and you worded it perfect. It's because of where Laura was prior to and all the way up to it.
Right.
And that's, it kind of just backing up just a little bit. It's like you go to your 6 or 8 week checkup. Had you been doing nothing, you'd probably have a ton of low back pain because you've just been laying around.
Right.
You would be totally unstable.
Oh, yeah.
It's like all of these things. And it's just,
but the worst is you're probably losing your urine.
And you may not realize it yet because you're still healing, or probably at those first couple weeks, they're like, okay, well, it's still part of your healing process.
I mean, she had a C-section, so it's probably less in that population. You can correct me if I'm wrong. Maybe I'm overstepping my bounds there. But the point is that it's normal for you to show up at that appointment with all these abnormal things and for it just to be swept underneath the rug. Like, man, that's part of being a mom. You should probably just continue with what you're doing.
Oh, and the best that I get is I have patients that they're like, thank God they still came to see me, is my doctor told me to wait 6 months. And if it's not better, we can do PT then.
Yeah. For my sensitive ears in the audience, cover your ears. Fuck that. Okay.
Yeah.
I just cannot get behind that in any way, shape, or form. I cannot tell you how passionate I am about these moms and what they're told is normal. And for 6 months for them to be absolutely miserable. And then when the moms get together because they were given the same information, it's normalized in those groups of people. Let me tell you with 100% certainty, it's not fucking normal. It's not fucking normal. And it makes me so mad. And the whole reason why I have these 2 ladies on is so that I can get the medical perspective on that and I can get the personal perspective on that to back up what I see in the clinic. And we're all in congruency there that's not normal. Talk about that, Susan.
No. It's,
so fired up.
I get so fired up. And so,
probably nowhere near as you.
I'll be honest, I have stopped for now, even marketing to OBs and kind of talking to them because I feel like they hear me and then the information is just kind of disrupt, whether it's a time thing or they just, I don't really care to go down that, but I tell every single one of my patients, and I think I probably got part of this spiel from you, Ron, because this is how we were when I was a tech is, my best marketing are my clients. That is where it comes to. And it's even more so in this population, because I was like, every woman that comes through has a mother, has a friend, has a sister, will have a daughter at some point, those aspects, and those conversations are going to come up. And the more we can change that narrative of, oh yeah, it's normal, I did it, to no, that's not normal. You need to get some assistance with that. You don't have to live like that. That's where I get my referrals. That's where I start to see the changes. And that's the only way we're going to make a difference in changing this.
It's more than making a difference, Susan. It's changing people's life. It's installing a quality of life that is so incredibly important to the health and well-being of the mom, the baby, the marriage. I mean, it affects so many things for that normal recommendation that it just makes me crazy. I mean, inability to have sex, inability to control your urine, those are major, major, major stresses on moms. And as soon as they look at each other and say that it's normal, I lose my mind. And so that's the main message for today. All right. So that was 7 weeks she started deadlifting. 7 weeks. Let's continue.
And you were having no pain, no issues at this point.
Nope, no pain.
Not a drop of urine.
Nope.
So 9 weeks. She's just being Laura here. I was like, you lifted how much? You did how much? Just being Laura.
Felt good. Oh, this is where I was. This is the first time I did box jumps, and I was worried that I was going to have urine loss because Ron and I had talked about it.
Stop. Yep. So the position that she was in obviously creates some gravity to pull down on those abdominal contents, right? We had this really great lesson with the pelvic bones and everything, right? So the can is, the top of the can and the bottom of the can, everything's driving towards pushing that urine out, right? But because she did the right exercises pre-pregnancy, during pregnancy, and then after pregnancy, we started with that. Those concepts were already secure when she gets to these.
Got it. And that's what it's so much about. It's the connection that we lose.
Yes.
At some point during delivery, postpartum, and then it's never reestablished.
Right. When those gears get off, if you don't reestablish the gears, then you're not going to be able to get to this place. And
that's why Kegel's alone don't work.
Right. And it makes sense because it's only the superficial layer.
But they do. But everybody says that. Everybody says like, "Oh, do your Kegels, do your Kegels." And then when I went to Ron, like, and we were doing like the first part of PT, like just the breath work and like how to engage like the top of my core, like everything. And I'm the type of person that like, do not tell me the scientific words, just tell me what I'm supposed to do. Like I don't. And he's like going like transverse abdominal, whatever. And I'm like, okay, but tell me what I'm supposed to do. Like I don't care. So, but like that, just like feeling that was so. Remember, I was sore. I think I was sore for like 3 days. I came in and I was like, am I supposed to be this sore, like from breathing? It's weird. But like, if you're doing it right and like thinking and all, it like being aware of your body and what you're doing, I think that like that makes the biggest difference.
And and what's interesting about heavy lifters is the knowledge and experience of how to fire that core, how to set that corset is the same muscle strategy that you use to get underneath a heavy bar. So, squeeze your abs. What you're actually trying to do is this core setting. Yeah. So, it ends up being a functional thing is my point.
It is. In the beginning, and for most of my clients, I've strayed away from even mentioning TA or trying to engage with the core because I get too much of like motor moron processes where we just kind of bear down.
Right.
So what I've started to do is I really, really focus on that exhale and connecting with pelvic floor while my hands are on TA.
Right.
And so I can point out, and I was like, do you feel that? And they're like, yeah. I was like, so here you are doing core work, you're engaging TA, and I never said anything about anything in your belly. So I think that helps kind of also drive home, you got to zip up, not bear down, because that's going to put downward pressure through pelvic floor, and helps to gain that connection back a little bit more.
Yeah, the cue is zip up is really, really enlightening. I like that. I might steal that. Okay, let's keep rolling. So that was, what was that, 10 weeks?
Mm-hmm.
So 3 months. And this is really heavy. I would say 250.
Yeah.
And how'd your scar feel through all that? Scar felt okay?
Yeah, I did like with like massage the scar and I got all sensation back, but it was at first I was worried because at first I couldn't feel anything like around the scar.
Weird.
Yeah.
It's really weird.
But then
315 here at 7 months.
That's fantastic. If you don't mind me asking, through this, were you breastfeeding?
Yes. So I nursed for a year.
Okay.
What does that mean to you, Susan? Why did you ask that?
Because the hormone fluctuations throughout your pregnancy continue through all of your breastfeeding journey.
Got it.
Because of milk production, those hormone fluctuations are still happening.
That influences connective tissue properties?
Mm-hmm.
Gotcha.
So for some people, and again, as we're looking, we may see plateaus, we may not be progressing. And sometimes, I will give moms
progressing in exercises.
Progressing in exercises.
Got it.
Yeah.
Got it.
And just kind of this, and sometimes it is just like this off feeling, like and I never say you're getting your body back. I don't market that way. I think that's an inappropriate way to market to moms. This is rediscovering your new body and what it has done and what it's capable of, and kind of finding that new boundary.
Right.
But there are some of that, those implications for some people might be shifting through that entire time. And it changes because as you hit different mile markers with nursing, as you introduce food, your milk production changes. As you're weaning off, your milk production changes. As you're done, those hormone imbalances will change. And I will give moms a timeline of 3 to 4 months after you're done nursing to really start to feel like things are just coming together. It's like,
gotcha. So be patient. Be patient.
Exactly.
Manage the details and listen to your body. Trust your body.
Exactly.
Yeah.
Yeah.
Man, that's awesome. So the last one was 7 months postpartum here. 8 months, 185 power clean here. Woo.
Look at that. That's amazing. Oh,
yeah.
look at her there.
Look at what she's teaching her back there.
Oh my goodness, a little fist bump. I love it.
How great is that?
Ugh.
See? Moms can do heavy things.
Yeah. Look at that. And just the example you're setting for her.
Totally, right?
I love working out in front of my kids. I mean, I don't get to do it often because I try to work out before they get up.
So the thing that I want to point out is like how amazing her body looks, right? That's one of the things that moms have a hard time with is like, am I ever going to get my body back? Well, attention to detail pre-pregnancy, attention to detail during pregnancy, attention to detail after pregnancy, and her body's responding to all the stress in a really, really great way. So she was dropping weight, she was getting fit, and like she's mowing people down in the workouts. And
you were still feeding a tiny human.
That's what I'm saying. It was amazing. It was amazing. Super inspiring to watch.
We're sustaining a life and doing all of that. That's just amazing.
Yeah.
I look back, I don't think I gave myself enough credit during. I watch these videos and I'm like, whoa, like moms are amazing. Like that my body is amazing. Like look at this whole journey.
Amazing.
But I don't think in the moment I was like not giving myself enough credit. And I think that's important. Like we need to
absolutely
like look at ourselves and be like, wow, this is cool.
Right.
I think that's why I love working. Like my niche is that pregnancy and that first year postpartum, like because being that advocate and that cheerleader and that guidepost for you in such a vulnerable time is huge. And, after the baby's born, you get 6 weeks and that's it. You get a 6-week checkup and there's not enough maternal support after you have a baby.
Yeah. Is that the truth?
And so that is why I'm such an advocate for moms during that time.
And that's why my heart swells, because here you are out here changing these women's lives. I mean, I can't tell you the number of times in my 20-year career where 2 years ago, 5 years ago, 10 years ago, I had this baby and I'm still having these limitations. The amount of quality of life that you're changing because you get started on the right stuff right away is insane how much better you're making these women's lives. So I'm so proud that this is your place and this is like what you're meant to do. And it's really cool watching your growth so you can be able to do that. So
I wouldn't be here without you, just so you know that.
Well, don't forget that. No, I'm just kidding. Let's keep going. Not really. Go ahead. You would have been there anyway. $295, 10 months. So I didn't crop this one because, it's just amazing how her body looks, right? I mean, it's not about cosmetics all the time, but like how many moms are so into that cosmetic side of it, not to mention heavy for a set of 5.
Strong. Yeah.
Super strong. And this whole time, no urine loss, no trouble, just back on track. And then her and her husband in a CrossFit competition. Go ahead and stop. Talk about that, Laura.
Yeah. So he wanted to do this competition. I kind of was against it because I don't know. I would just, like you said, it's that first year I didn't feel like myself. I was still not doing some of the stuff that I was doing before. And like, just because it takes time to do all that. And so he wanted to do this competition. And I was like, all right, fine.
Competition ready in your eyes.
Yeah. And we ended up getting 3rd. So
amazing.
We could have got 2nd or 1st, but it was his fault. He stopped.
Yeah. Your legs were extra tired from carrying Dennis on your back. Is that what you're saying?
Exactly. But yeah, Dennis is great. Like through the whole, I look back on like my whole, that first year is just so awkward because I've never had to restart lifting. I've only, progressed over time, and to go back and have to like lower the weight and restart. And Dennis was like really cool through the whole thing. And he always made sure that like because I just love working out. I love every part about it. And he made sure that I always had time in the day to like work out. And that was like the number one, like to make sure like mentally, I knew that's where I was going to be the healthiest if I was working out. And he always made sure that I was able to work out. And so when he signed us up for the competition, I was like, no, because now I have to get like competition ready. And I didn't feel like I was competition ready. And it's just so different. Like I look back to like the past where I didn't have to take care of a baby and nurse and feed and do all that while
sleep patterns are off and
and like trying to train, and I was able to just train 3 times a day or 2 times a day and not worry about a baby. And now I have to like rearrange my day. And so it was really different, but it was also really cool to see that like I wasn't far off from where.
That's what I was about to say. On foundation strength alone, foundation work alone, 3rd place in a CrossFit competition.
Mm-hmm.
Yeah. That's amazing. Super duper impressive.
Yeah.
It's really cool. It's just amazing. All right. Mm-hmm. Almost through this video here. 11 months, 205 pounds front squat. Good depth, good load. Look how old Rookie is. And then 255 squat, 14 months postpartum. £345, 14 months. Wow. Boom. Bench press. And that's Dad right there.
Yep.
And video's not at the clinic, which, is kind of,
I know.
Whatever.
That's when I
gotta do what you gotta do. So Susan, talk about that. Talk about pre-pregnancy, pregnancy, post-pregnancy. And, obviously this is probably a high flyer compared to most, but at the end of the day, that's who she is. And we just continued with who she is. So, from your seat, talk about that.
Yeah. At the end of the day, it's like, you take that principle and you just apply it to the person. That's one thing about PT or, a good PT is that every program is not cookie cutter. It's individual to that person. In the setting that I'm in, I don't take insurance, and I am able to, that allows me the freedom to spend the time I need to with my clients. So my evals are 75, 90 minutes long. So I'm getting their full story, their goals, their wants, their desires, what they are gravitating towards, and then also all of the objective history or objective exam as well, to really put those pieces of the puzzle together. And it's going to be different for every person, but the principles at the end of the day are the same, is that you have to build a good foundation first. You have to get the breath work, the pressure management, the neutral alignment, good ground reaction forces. And that has to be the footwork for every single thing that we progress through. Now, what that looks like: CrossFit, heavy lift, powerlifting, Orange Theory, Zumba, lifting at home, it doesn't matter, because the workout that you're going to do is the one that you enjoy doing. And that's where it's like, I'm not an expert in every type of workouts program, but I can, you give me a little bit of feedback. I can watch videos. I can look at this. I use my resources, and I'm going to apply those foundational pieces that we build off of in that first 6 to 12 weeks, and get that person to where they need to be and what their goals are. And it's doable in every single individual situation. It just looks different. And it's up and down. I guess that's the other thing I want to say, and Laura, you can probably attest to this. We saw that progression, but absolutely your progression was not linear.
No.
We're seeing the highlights of it, but that is, this is not a linear thing.
Yeah, there was a lot of tears, and there was a lot of me begging wrong. Like, how long is this going to take? When am I going to be back to normal? Like, I call him the wizard, because he's literally fixed any injury I've ever had in my life that I thought I was going to have to live with. And so I would go to him and I'd be like, you're the wizard, like, make it go away, or like, make me feel, back to how I was. Cause like you said, nobody prepared me for that first year of, being a mom and like trying to get back to where I was before. And I mean, like, yes, I was like trying to like lose weight and like get back to like my pre-pregnancy body, but also like, I just cared about working out how I was working out before. Right. And nobody prepared me for that. I mean, like, Ron did the best he could, I think. Like, I mean, he definitely was like the only person that I had besides like my family, like my sisters and my mom who's had kids, but we're just like different. Like, they don't work out like I do. And so they don't understand that journey. But like you said, it was not all highs. And there was times where it was like really frustrating because it was a low. And, maybe I should have included some of those too, like just like a frustrating video or something.
Well, to your credit, you never backed off. You kept your trajectory moving forward, and you didn't listen to the haters, and you didn't listen to the negative and the toxic. You continue to work, and like, that's where I think a lot of moms will buckle. Because there's so many people around them telling them that they're doing something bad, that they must be doing something bad. And then the pregnancy takes a right turn, and it ends up in a place they didn't want it to be in the first place. So to your credit, you didn't back off. And I think that's that consistency, that attention to detail is why you did such an amazing thing. And in my opinion, the healthiest pregnancy I've ever seen or been a part of. And maybe not everybody needs to be, 265 pounds 10 weeks after, but at the end of the day, you managed the forces on your body so brilliantly. And I don't think that's a common way moms approach this athletic journey that they weren't sold on. You know what I mean?
Yeah.
So at the end of the day, I'm super proud of what you did. I was humbled to be a part of it and totally inspired, because look at that bump. If she can do it, why can't I do it? And it was heavier and it was faster than the people around you. And I just was in awe the whole time. Whole time.
Well, thank you. I like I said, he's the wizard. He's fixed everything and anything that's ever gone wrong on me. And
So Laura,
I'm so grateful.
Laura's got some online programs. She can help you with your strength gains. She can help you move some heavy loads.
Yes.
We are actually probably 30 minutes now over, which means, this is probably a really good topic. And there's a couple of things that I wanted to get to Susan on that we don't have time for. So Susan, would you be willing to come back and let's do like a whole show on the things we didn't get to?
Absolutely.
Oh my God, that'd be great. Maybe you should have one.
Excited.
Maybe you should have a podcast. But I always end my show with a little bit of fun. Laura, what are you listening to in Ohio? I mean, in Texas or
in Texas or
Utah?
I'm on a really big true crime kick right now. So my podcast that I've been listening to, it's this girl called Kendall Ray, and she just does a lot of true crime videos, and I am obsessed. So that's what I've been listening to. It's not music, but
Gotcha.
It gets me through a good run or workout.
I never intended for that question to ever be anything but music, but it's really turned into this eclectic approach to what everybody's listening to. But true crime, huh? So is it like stories?
Yeah. So she'll take a crime that's happened and she talks about it and she gives all the details. I mainly listen to it when I run.
So you're like a detective?
Yeah, she's doing all the work though. I'm there with my popcorn.
Gotcha.
My running clothes.
You're like hovering around this detective.
Yeah.
Gotcha.
And she's really good. I love her.
Gotcha.
She has a YouTube channel, but like I said, if I'm running or whatever, to me, that's the fastest way to get through a run. I'm like, oh my gosh, who killed her? What? And then I'm like, oh, it's been 30 minutes. Away. Oh my gosh. Where am I going?
That's so funny. Susan?
Yeah. You're going to laugh.
I know. Can I guess? Can I guess?
It's not country music.
Susan's a huge country fan, and she was surprised to learn that I've now included country into my life. I'm
so proud of you.
Welcomed it with open arms and let it wash over my heart. I would guess that you're listening to kid stuff.
Yeah.
Yeah. What did you say?
It's the Encanto soundtrack.
Oh, girl, I'm right there with you.
I actually think I like it more than the kids.
Oh, really?
I love it so much.
I know.
So it's
really catchy.
It's an animated movie soundtrack.
Mm-hmm. Yeah.
Gotcha.
It's a kid movie. Encanto.
It's
gotcha.
The same guy. That did,
as a single 45-year-old, it's kind of weird to show up to animated movies, so I have to wait till they can be played at my house. But I like them.
Man, all the way.
Yeah.
It's kind of weird. Can't be a middle-aged man showing up at a kids show. It's frowned upon.
Not with that attitude. do you, boo?
Whoa, check it out, everybody. No, I'm listening to actually country. I saw Maren Morris at a festival a couple of years ago, and I wasn't super impressed. But she's been being played on country radio that I listened to, and a couple other songs. So I listened to her new album on a recent road trip, and her new album's really good. Either she's better or I've matured in my listening to her, one of the two. Probably the latter. And it's been that, and I also started reading a book by Vanessa Van Edwards, or listening to a book by Vanessa Van Edwards called Cues, and you should check that out because it's pretty interesting. I would love to extend a big thank you to my two amazing women. You guys made this probably one of my better shows, and I would love to continue this topic more. I think this is a really, really underserved population of people, information that's not as well known as it should be, and I would really love more of this discussion moving forward. So thank you guys so much for being on my show, and I know that your guys' time schedules are not the same as Vegas, so this is like a weird time in your day, so thanks for taking the time to be here. So thanks for coming.
Thank you
so much.
Trav, that's all for today. Hyperspeed Radio. Let's see that sticky pause. Thanks, everybody.